Now we're going to move to Professor Mladen Poluta, a friend of mine as well. He works as a health technology in South Africa. He's going to talk about emergent team collaboration approach and how the teamwork is important to confront COVID. The floor is yours, Dr. Mladen.
Thank you, Riyad, and thank you to the CD for inviting me to this seminar. If I'm not looking as handsome as I usually do, it's because I'm recovering from surgery, but I've been the privileged beneficiary of excellent medical care, of frontline emerging medical devices in a facility that is well run and well maintained. So I've been on both sides of the fence in the last week. So when yesterday's seminar opened with the announcement that Tazeen had recently had a baby, I thought of the foundational nature of parenthood and how that should inform what we do and where we invest our limited resources in asset management, as an example. It also called to mind the saying that it takes a village to raise a child, and how we not only need one another, but may require the assistance of others outside our immediate circle, and how in this time of the COVID pandemic, we faced many unexpected and unfamiliar situations that necessitated a new, different approach. But the situations we found ourselves also called for responsive, tailor-made teams, as well as the need to move quickly and effectively as per disaster preparedness and management principles, as mentioned yesterday. My presentation reflects on a selection of teams that I am or was part of during the last year as part of my department's response to the COVID-19 pandemic. Some will be disbanded, but could be resurrected at short notice. Others could continue, but at reduced intensity, while yet others may never reappear, but will hopefully have transformed how we do what we do as part of the new normal. So you have most likely all heard of the saying that every cloud has a silver lining, and despite the ongoing sadness and loss, there are many silver linings of the COVID-19 pandemic. And what is important for me and what is not reflected upon is ourselves and the decision circles we find ourselves in, and particularly the ad hoc teams that are created to address emerging issues, often but not always associated with projects. The enabling tools that we have been privileged to have access to, our department is as standardized on Microsoft and Windows, and we've been using the Microsoft Teams app, but there are others too. But these enabling tools, certainly in our context, have revolutionized the achievement of goals and objectives. And they've maintained efficient and effective discussions, whether they are synchronous as they are now, or asynchronous, as well as providing repositories of what has been discussed or what will be discussed or reference material, and that all leads to institutional memory. I see teams as special category assets. Some will be transient, as I've indicated, others will be long-lasting, so they have variable life cycles. Many have brought people, stakeholders into one room, virtual in most cases, for the first time. And their effectiveness depends on challenges being faced, and these may change from time to time, as we all know, relative to their collective capabilities. So there's a need to look at that gap, if one does exist, between the challenges that they are facing relative to their collective capability. And part of the emerging reality that we faced was the realization that some issues could be fairly easily handled, while others needed a new approach. And yet others still presented a situation where we honestly did not know how to respond other than to do something as soon as we could. And the tragic situation that Riyad, his colleagues, his family, friends, country found themselves in is just one example. So a complexity science framework, particularly useful in analyzing the complexity landscape, is one that was developed by David Bowden and colleagues, as presented in this Harvard Business Review. And it shows essentially 5 spaces, going from 2 ordered spaces being simple and complicated to 2 unordered spaces being complex and chaotic. And the action, the predominant action in each of those spaces. So categorize for simple, analyze for complicated, probe for complex, and act for chaotic. And then in the middle, where in some cases I would venture to suggest we have all found ourselves in within the last year, we've got a disordered space, which in a sense almost freezes us for action. So I think it would be very helpful when we reflect on teams to look at the balance of the different spaces that they found themselves in at different times, and whether they had or have or need to develop the skills that enable them to address similar situations in future. Next, please. So the first team I wanted to share with you is my own team. So this is the team within the Health Technology Directorate of the Western Cape Department of Health, which is one of 9 provincial departments of health in South Africa, obviously public sector. So fairly early on in the pandemic, and now this is May last year, April, May last year, we identified what we consider to be essential health technologies that are required as part of our department's COVID pandemic response. So we drew up this simple matrix of the items down the first column, essential HTs. Then what we did is we assessed the needs, and we did that by interacting with our critical care forum, which essentially tabled the requests in an ICU environment, in other words, an invasive ventilated context, as well as from our metro health services and rural health services, which included all other service contexts. And that presented us with the total service requests in the 3rd blue column. We also had a list of projects that we were responsible for or were partners into, including our 2 hospitals of hope, as well as numerous viral triage and testing centers, stations that were set up at our health facilities. And these collectively were reflected in the next column, which is the total project requirements. And then the first yellow column indicates the total requirements across both services, service needs, and project-related needs. We then looked at what stock we had pre-COVID, what we had ordered, what we had donated, and what the total supply is or will be, and then assess the excess shortfall, and that being the gap between the total requirement and the total supply. We then engaged with our service colleagues in what was called the Silver Command. So there were 3 commands set up. The Gold Command was the top level management command that was set up to manage our department's response, and that was overarching. The Silver Command essentially looked at the health services, whereas the Bronze Command looked at my own chief directorate, which was responsible for facilities and infrastructure management. So here was discussion, a very rich, very important ongoing discussion with the Silver Command as to what their requirements were, whether there were new needs that we are not aware of, and what we were doing in order to meet their current and anticipated future needs. Next slide. The next team is one that had a national spread. So based on information and learnings from primarily our Italian clinical engineering colleagues ahead of us in the first wave of the COVID pandemic, we recognized the need for non-invasive respiratory support devices. As you all know, all countries were chasing a limited number of supplies and stock at that time. And so what happened in South Africa is that a national ventilator project was set up by government in order to address the need for these non-invasive respiratory support devices. And the category that was settled on was CPAP as a subset of those devices. The team that was tasked for actually managing the project were the same team that have been developing the square kilometer array in Sutherland in the Western Cape. Nothing to do with healthcare, nothing to do with medical devices, but excellent engineers, systems engineers, etc. And they were tasked with analyzing what was required, putting in place systems and structures to gather what could be made available in terms of innovations, to assess those, and then essentially to bring those to our market. So there was collaboration with local manufacturers and also close collaboration with the Medical Devices Committee of our regulatory agency, the South African Health Products Regulatory Agency, and I was I'm privileged to be a member of that.
Mladen, you've only got 1 more minute. Thanks.
National Department of Health was an important stakeholder, as were provincial departments of health, and health technology managers acted as the primary interface. And this is an example of one of the briefing sessions that we had recently. Next slide. The next team was an extension of that, where we looked at devices that had been donated from various donors, NGOs, and where those had been distributed within our province, and how many of them were being used, if they were being used at a particular facility, and the number of adverse events that were recorded. Fortunately, none. Next slide. The next team was a team that was created within our department to manage oxygen supply. And this was called the Day Oxygen Huddle. And this was only established during the second wave in mid-December. So there were daily meetings that comprised key stakeholders from within our department, as well as the supplier that had the national contract to supply oxygen. And what you see before you is the spread of their customers in the Western Cape, including both private and private sector, the capacities of their various storage tanks, their daily rates of consumption, and the percentage levels of capacity of their reservoirs, which led to a response from our service supply in terms of topping those up. Next slide, please. And the last team, just I mentioned in passing because disaster preparedness was mentioned yesterday, a national forum was also set up to provide guidance in this example on oxygen safety. Next slide. So I wish to thank you for this opportunity. I look forward to questions. And as I mentioned, I feel privileged to be part of this webinar and of this team. Thank you.
Wonderful presentation. Thank you. Thank you.